Happy December and welcome to our last Instagram and Facebook Live of the year. I'm Dr. Jay Kim, your facial plastic surgeon. Over the past few weeks since they started working here at this office, and one of the new things that we will be offering soon is microdermabrasion. So microdermabrasion is a very nice way to have little to no downtime procedure to give that glow to your face, really extract some of the dirt and gunk that is building up in your pores. We're going to offer them in packages so that you can develop a relationship with either Catherine or her son, and they can get to know you and your skin and provide the best options for you for at-home treatment as well as for in-office care. So look forward to that. Please check your emails. We'll be sending out a notice in the pretty near future. So what I want to talk about today, again, is filler. How much do you need? So what's the whole point of filler? Filler is to replace volume where volume has been lost, or where you would just like some more because you were born with maybe a little less volume in a certain area of your face. Filler is made out of one of two materials. It's either hyaluronic acid, which is a gel. Hyaluronic acid is also a natural compound that occurs in your skin and tissues, and so replenishing it with a hyaluronic acid material helps bring volume as well as moisture. The other material that filler is made out of is calcium hydroxyapatite. It's basically, we know it as Radiesse, and it acts more like bone in a syringe. It's a white pasty material, and it also works in nice ways as well. So I use a variety of fillers. So there's the Juvederm company, there's the Restylane company, and then there's also Radiesse. So the question is, how much do you need? So this young lady came to me saying that she was concerned about volume of certain areas of her face and neck. She has very nice facial features, but looking at just from top to bottom, these are the areas that you can put in volume or replace volume. So we'll start from the very top here, okay? She's a young woman, I think in her late 20s to early 30s. And so if you go from the top, you have a little bit of thinning out of the temple area here. And so replacing volume in the temples is a very good place to start because it accentuates the overall round, youthful shape of your face. That upside down egg shape of beauty is what comes back if you replenish this area with a little bit of filler. Okay? The next area that people commonly look at is this area called the Nasolabial Folds. And this is the border between your cheek and your upper lip. So what happens over time is as things come downward and in, you get a hill right in front of this nasolabial fold, which makes this area look like a shadow. Now, to help this area, you have to start from where the descent or movement of tissue began, which is right up here on your cheeks, okay? Now I tell all my patients that we want to accentuate the upside down triangle of beauty, which is cheek to chin. And in order to do that, you can accentuate your cheeks with some filler, okay? That's another good place to have filler. So the next spot is in the nasolabial folds directly. Now some people have full enough cheeks where they don't need to accentuate their cheeks anymore, but they would like to help the shadow. So sometimes we put filler directly into the nasolabial folds too. The next good place to go for fillers is along the jawline. And there are three distinct areas. You can fill directly in the middle with the chin. If you have a short or weak chin, that's a very good place to add projection and or height so that it accentuates your triangle of beauty. Okay, the next common place that we fill is in the Marionette lines and in the Pre-Jowl sulcus. Now, if your tissue comes downward and kind of builds up right here, right where my finger is, there's a little bit of a concavity. So it's full right here, then it's a little shallow right there before it goes to the chin. So you can smooth that area out with a little filler as well. And then one of the more popular things we do nowadays is to accentuate your jawline. Now, people like Angelina Jolie, Olivia Wilde, George Clooney, Brad Pitt, Cristiano Ronaldo, they all have jawlines that can cut butter, right? Now, for people who want that jawline, we can put a little bit of filler along this area too. Okay? So that's just the top to bottom kind of run through of places where we commonly place filler. The other two places that are more towards the center of the face, the other three actually. So you can place filler along the lips, okay, and you give yourself a nice alluring set of lips, very nice accessory for your face. The other common area is around right here, the tear troughs we call it, okay, because the eye socket bone is placed a little farther back than the tissue right along your lower eyelids. So oftentimes when people don't have too much eyelid fat bulging forward, rather it's a shadow that's farther back along the eye socket bone, we can put a little filler there. And last but not least, we sometimes put filler in the nose to create a more even shape or balanced shape. Okay. If you want more discussion about nose filler, you can refer to some of the past IG lives as well. Okay, so this young lady, her main concern was that she had a little bit of a shadowing along here, the nasolabial fold, and then also that she had a weak jawline. Okay, so I talked with her about her possible treatment options, and we decided to go for cheek filler so that this contour dominates more and accentuates her triangle of beauty, and then also we added some filler along this area. Now, how much filler did I use? If you think I can use one filler and have that be enough, that's a real big no. I actually used, I think, 3 total syringes. Okay, and the reason is this. She's young, okay, and she has a relatively small to medium-sized face, so meaning she doesn't have, super large facial features. So in order for it to make a difference, you would say that, you don't require a ton of filler, but in order to enhance these multiple areas of the face, you would definitely need more than 1 syringe. So by accentuating her cheeks, I often start with 1 syringe of filler divided between the 2 sides. And the patient looks in the mirror immediately afterwards and gives me feedback about what they like. Okay? If they want further augmentation or rejuvenation, we keep going. Otherwise, we can pause right there and reevaluate a few weeks later. And at that time, if they want to continue the treatment, I'm more than happy to do that for them. Now, with regard to jawline, okay, it depends how strong or weak your jawline is and how much definition you would like. I would say that at the very minimum, you're looking at 1 syringe per side to get the definition and contour that you're looking for. Okay, if you want a David Beckham jawline, but you have a weak mandible to begin with, you're not going to get it with 1 syringe alone. You'll probably have to start out with 2, maybe even 3. Now, does that mean that that's the end of it? Sometimes not. Depending on how the filler kind of rests and incorporates into your tissue over the following weeks, you may require a little more filler to get to the goal that you want, or you can stop right there. Okay? So let's continue with the next person. Okay? Overall, she has a relatively thin face and not super big facial features. But in terms of this jawline, that looks really nice. So I didn't have to do anything with that jawline. But in order to help her with this area, with this area, I would say that her cheeks are actually a decent volume. So from her triangle of beauty isn't necessarily anything that I would have to change. In fact, the only thing would be right here, where there's a little bit of etched in lines from her smiling so much. I met the patient's son, so I know that this patient has a lot to smile about because he's a very nice kid. But anyway, that kind of filler in that amount of a line with that amount of depth, you probably start by using one syringe between the two sides, okay? And depending on how that incorporates into the tissue and moves with her as she makes facial expressions, you can kind of go from there as to how much treatment you would like. Let's go to the next one, please. Okay, so this lady's a little older and she has bigger facial features, fuller facial features. And what has happened over time is that things have dropped down, okay? So you see shadows right here, so right here, okay? Her cheekbone is fine, and then it drops off here, and you see a shadow or a relative plateau. And then you see a hill and then a valley. So if you fill only this area, it will look off balance. You'd rather start here. Now, this person has slightly fuller face with fuller facial features. So I started with one syringe on each side, and I would say that she still has more filler that could go in to get to the result that she wants, okay? So cheeks especially, it's a relatively large area. So for people who have fuller faces, you'd probably want to start with 2 syringes and go from there. Sometimes you need 3 or 4, and that's just based on your anatomy and how the filler incorporates into your tissue. Let's go to the next. Okay, this lady has good facial features, okay, and in terms of her cheeks, I would say that they're a pretty good volume, and then her jawline is moderately crisp. If she wanted to highlight that more, that would certainly be something we can do, and I would probably start with 1 syringe per side. In terms of the nasolabial area, if she wanted that shadow to go away a little bit, I would probably fill that nasolabial fold directly and not mess with her cheeks at all, because she has pretty nice, full, beautiful cheeks. And her triangle of beauty is very much emphasized. Okay, so this young lady, she came to me because she had concerns about her under eyes. And you can actually see her actual before and after on my Instagram. She came because she wanted a little bit of rejuvenation right here, and she could see the dark circles, okay? Now, if that term dark circles resonates with you, then this is the one you want to watch out for. So the reason she had dark circles is not so much because she had eyelid fat coming forward here, but more because the orbital bone right here was set farther back. In addition, when people ask about tear trough filler, I always at least bring up the discussion to bring some rejuvenation to the cheeks as well. So for her, I did a little bit of cheek filler because she has pretty good cheeks, but she doesn't necessarily benefit from a lot of volume of cheek filler. But I also fill the under eyes as well. And for under eyes, we use a slightly softer filler, such as Restylane L or Volbella, and we put it deep into the tissue, almost onto the bone, so that it brings this valley up to meet the rest of the facial tissues and have a smoother contour. So I used only 1 syringe of Restylane and split it between the 2 tear troughs, and it worked out very well. All right, again, this lady has fuller facial features. Okay, it's just how she's made, and we have to work with the facial features that she brings into the office. So I think I used 4 total syringes of Radiesse. Now, a little side note here, all of the hyaluronic acid syringes, filler syringes, come in 1 ml. Now, if you can imagine what 1 ml is, it's probably the size of a medium blueberry, small to medium blueberry. Now, Radiesse, however, gives you 50% more in a syringe, so that's 1.5 mLs. Still, if you think about it, 5 mLs or 5 syringes of HA filler is 1 teaspoon. Now, for those of you who are bakers, you know how small a teaspoon is, okay? We're using these small volumes strategically placed throughout the face to change shapes and contours, to bring back youth, to refresh, to rejuvenate, okay? So the areas that I treated for her included the cheeks because they seem kind of sunken, okay, compared to the remaining architecture of her face, and they don't look very emphasized at all, okay? So if you can see, there's the triangle of beauty is upside down, cheek to chin, but over time, what the triangle that you can see more of instead is this right side up triangle, okay? And you don't want to see that as much as you want to see this, okay? So I treated her in several areas, including the cheeks, to bring that out, so that the light really hits the cheeks and gives it a nice shape. And then the nasolabial folds, and then the marionette lines, and also the pre-jowl sulcus. Okay, this person did not want a facelift or was not a candidate for facelift surgery. So another option is to give her that smooth, more youthful look with filler treatment, which is commonly known as a liquid facelift. And this young lady, she, I think, is in her mid to late 30s. Don't let that youth fool you. She looks younger than that, obviously. But one of the things that she was concerned about was her nasolabial folds. Now, she has a small to medium face, so, but you can also see that her cheeks are not the star of the show, okay? Overall, her facial architecture is more rounded, and there's not emphasis on her cheeks and her chin. So for her, I recommended that she get a little cheek filler and a little nasolabial fold filler, and I think that was that. Okay, so this young lady came to me recently, and this is a before and after, immediately after treatment. Okay, so there are 3 areas that I treated for her. She's young, and so she brings very youthful and pretty features to the table. However, if you look at the before picture, you see the 3/4 view of her cheek. It's not super round, okay, and so it's not catching the ambient light right here, and it falls a little flat right there. So what I offered her was a little cheek filler so that it accentuates this contour, and along this line you see a slightly more full contour, but it's not unnatural. So that's the first treatment I did for her. Now the second treatment, she was also bothered by this little shadow right here. So that's the tear trough area, the border between your lower eyelid and your cheek. So we put a little bit of tear trough filler in here. I didn't even use a full 1 ml of the syringe. I used maybe about 0.8 or 0.9, and we got a nice change here. So that's great. The third area that she wanted to treat was the lips. Now she already has full lips, okay? But just to give it that extra allure factor, that extra pow, okay, we did some lip filler, and she's very happy with her treatment, I'm glad to say. All right, and last but not least, this lady is in her 60s, and her main concern was the aging around this area. So the line going from the corner of your mouth down this way is your marionette line, okay, and then the concavity right here at the end of your marionette line is your pre-jowl sulcus. She wasn't interested in surgery at the time, so what we did for her was soften this area with Radiesse filler. And so Radiesse, I found, is very versatile in certain areas where you need volume, but also you need a little flexibility, as well as some structure. So I found it to be very good in these situations. And this is about 3 or 4 months after her treatment. So as you can see, the pre-jowl sulcus is a lot better, and also the marionette lines are a lot softer. Okay. In general, fillers last about a year in most parts of the face. There are certain fillers in certain areas of the face where fillers can last longer. Now, we're going to open the floor up to any questions.
So, one question from Instagram was, how do you know which filler is best?
So, how do you know which filler is best? That's a very good question. It's like tools in your toolbox. There are certain tools that are good for certain tasks. Generally speaking, you can categorize fillers into ones that are more robust, so that are more substantial, and ones that are a little thinner. Okay. Another way to categorize them is by how flexible they are. So certain fillers are thicker and not as flexible, while some fillers are thinner and more flexible. So take, for example, your cheek area. Okay, this area, there's a lot of tissue between your skin and bone, and also if you want to emphasize this area, you want something that is more thick and substantial. So you go for thicker fillers such as Juvederm Voluma or Restylane Lift, or the newest one on the market, Restylane Contour. For thinner areas, for other areas that move a lot, kind of like your marionette lines or your lips or your nasolabial folds, you want something that is less thick but still a little bit flexible. And especially for your lips, you want something that's thinner and more flexible. So for those, we have a variety of fillers. Juvederm, there's Ultra, Ultra Plus, and Velour. For really thin, for areas that require really thin filler, there's Volbella as well. In the Restylane group, there's Restylane Refine and Define, which are really nice, and also Restylane L, which is the oldest Restylane filler on the market. Depending on the area of the face, one of those fillers would be most ideal for you. For example, in terms of lip filler, if you have moderate to full lips to begin with, okay, and you want that extra pow, I'm not going to give you a super thin filler where you won't notice anything, like Juvederm Volbella. Instead, I would give you a slightly more substantial filler that is flexible and moves with you, kind of like Restylane Kiss, Restylane Refine, Juvederm Velour, Juvederm Ultra, or Ultra Plus. So those are some of the options that you have. In terms of lips, I don't go overboard too big all in one session. If super big lips is what somebody's going for, I usually bring them back for a second session for that second syringe. Okay, very seldom do I see patients who want that second syringe for lips. Usually one syringe is enough to help achieve their goals.
Okay, another question is, how often should I have fillers?
That's a very good question. So, as I said before, most fillers that are on the market today last upwards of about a year. So depending on your beauty goals, okay, if once you've achieved the look that you want with a certain amount of filler that you want, you're usually good for about 8 months to a year. Okay, and it's not a precipitous decline where all of a sudden the filler is suddenly gone. Okay, and so your body has incorporated it and then it starts to go away slowly. So even if you're not all the way to the point where all the filler is gone and you don't see it anymore, you know, when you're kind of almost to that back to square one, you can come in for your next appointment. So some people come in every 9 months after they've achieved their filler goal, but in order to get to that filler goal from the beginning, you might want a couple sessions, you know, about a few weeks apart actually. So when I'm meeting people for the first, who are having filler for the first time, I always, you know, do a moderate amount of filler treatment according to what they want, and then I always have them come back a few weeks later. Sometimes it takes more than 2 sessions to get to where you want, but regardless, once you're at that desired shape or contour or rejuvenated look, you're good for about 9 months to a year.
Okay. What happens if I overfill?
So let's say we go overboard and we put in too much filler in a certain area. Okay, with hyaluronic acid gel fillers, there is a way to melt the filler, and it's an injection that we call hyaluronidase. Hyaluronidase is an enzyme that breaks up the HA filler and melts it, starting almost immediately. If you put filler on a tray, or on any inanimate surface, and then you spray the enzyme over it, you can start to see that it melts right away. So for situations where you have too much filler and you would like it melted, that's absolutely something we can do. For a slightly more, for a more urgent situation where the filler has gone into an area where it's not supposed to go and it's causing an adverse event, you need to inject that area immediately with the filler melting enzyme, the hyaluronidase. That's why we always have at least several vials of hyaluronidase in our office, and every injector should. And you should ask your injector if they do have hyaluronidase, and vast majority of the time they will say that they do.
And last question, what's the deal with Radius? Why can't Radius be dissolved?
Radius is not hyaluronic acid, so the injection that melts hyaluronic acid is an enzyme that specifically targets hyaluronic acid. That's why it's called hyaluronidase. Okay? Hyaluronidase is not really effective against other substances, including Radius, which is made of a completely different material, calcium hydroxyapatite. Okay? There are ways to try to temper the calcium hydroxyapatite if there's too much or if it goes into a wrong place. But generally speaking, it's a little more safe in that regard to use a hyaluronic acid filler because you know there's an antidote that can reverse it immediately. So for that reason, there are a lot of hyaluronic acid fillers on the market, and in terms of non-HA fillers, there's really only one that people commonly use still, which is Radius.
If there's any more questions, Dr. Kim, any last comments?
So this is our last live of 2021. Thank you for your support and your encouragement throughout this year. In 2022, we promise to bring bigger and better things, and I think I hear Nala coming. Okay, wait. And, okay. Yep, Nala will be here at the office most days, so come and say hi. We're always here to answer any and all of your questions about your facial beauty, and our skincare specialists are here to offer their recommendations and treatments for your skin as well. So be on the lookout for further services and other promotions that are coming. We will most likely have a Valentine's promotion starting next month, so please look out on your emails. And again, thank you so much. Have a wonderful Christmas, Happy New Year, and we'll see you again soon.